Okay. Hi, everyone. I'm Rachel Sayko Adams. I am a research associate professor at the Department of Health Law, Policy, and Management at the School of Public Health. I'm primarily an addiction researcher, but my work really overlaps with the intersection of the suicide crisis, the overdose epidemic, and I would argue the alcohol epidemic as well. And today I'm going to talk about why I think the gun violence epidemic overlaps with those intersections. My work primarily focuses on military members and veterans, and that's what I'm going to talk about today. So military members and veterans are more likely to engage in risky substance use and develop addiction. In 2013, the Institute of Medicine declared substance use in the military a public health crisis, and the largest issue is really alcohol. The military is America's heaviest drinking profession. So a CDC survey in 2019 found that military members report more binge drinking days per year than any other profession in the United States. And once military members leave the military and become veterans, that's when we see a real escalation in diagnosis of substance use disorders. Again, primarily alcohol is the biggest problem, but other substances as well. And military members and veterans have been disproportionately impacted by the suicide crisis in our country and the overdose epidemic. So now I've talked about how the military and veteran population is a heavy substance using population, and they also have access and training in using firearms. So military members are trained to use firearms with precision. 45% of veterans own a firearm compared to about a third of other individuals in the United States, other adults. Military members and veterans are at higher risk for firearm suicide compared to civilians. Alarmingly, 7 out of 10 veteran suicide deaths are deaths by firearms, and 9 out of 10 of those suicide deaths use a firearm that's owned personally by the veteran. Firearms are a very deadly means of suicide, particularly if someone is trained to use them. So here I'm going to talk about a specific example within the veteran community that's at particularly high risk. We did a study of veterans using the Veteran Health Administration where we looked at veterans who were diagnosed with a traumatic brain injury or TBI, which is a very common injury among post 9/11 veterans, and looked for that if that increased their risk for death by suicide. And what we found is that veterans with TBI had increased odds of death by suicide compared to using firearms compared to those without a TBI. And veterans who did die by suicide, who had a more severe TBI involving a loss of consciousness, were more likely to have a firearm suicide compared to a suicide of other means. We also have a new paper that came out in JAMA Network Open recently where we were exploring associations of military, I can't see it on the screen anymore, of military-related TBI with new onset mental health or substance use disorders and looking at how that related to risk for suicide. And we found that the largest effect was for new onset the largest effect of new onset behavioral health conditions for death by suicide was through new onset substance use disorders. So this is an example of a specific population that is particularly at high risk for death by suicide and suicide by firearms, suggesting that we should really develop interventions in lethal means safety for these specific individuals. Now, lethal means are something such as firearms or medications that can be used for suicide or self-harm. And lethal means safety is an intentional voluntary process to talk to people about reducing their access to these lethal means. So lastly, I just want to mention another study I've done with VA colleagues where we were using mortality death certificate data to look at possible overlap of deaths by suicide, drug-related or alcohol causes to see how they may overlap. And traditionally, mortality studies only use underlying death codes, which are the primary code on the death certificate, but we were looking also at multiple causes of death codes in addition to the underlying death codes to see how these types of death may be more interrelated. And I've been thinking, I spoke with Professor Jay about this idea that it would be really worthwhile to dig into firearm mortality deaths and try to look at the additional multiple causes of death codes to see if we can learn more about how alcohol or other drugs related to these firearm deaths, which can inform prevention efforts and show us how these issues are more related. Here on the right side of the screen, I have some resources, a reminder about the new rollout of the 988 crisis line, which is now connected with the Veteran Suicide Crisis Line. And also this QR code links directly to my colleagues, excellent colleagues at the VA in Colorado who run the suicide prevention group. And they have a variety of information about lethal means safety that can be used to have conversations with people about increasing their access, increasing their safety and reducing access to lethal means. Thank you.